Think your blood pressure isn't a big deal unless you feel bad? Think again. High blood pressure is one of the most dangerous conditions that shows zero symptoms until it's too late. I'm Dr. Mickey from the Health and Wellness team at UB Health. As the AI face of UB's global network of over 1,200 medical providers and backed by insights from more than 12 million users, I'm here to help you separate fact from fiction. With so much misinformation floating around online, it's more important than ever to get doctor-approved info you can actually trust. That's why everything I'm sharing with you today is reviewed and approved by real physicians. Let's talk about high blood pressure, also known as hypertension. Why should you care? Because it's a major risk factor for heart attacks, strokes, kidney failure, and even cognitive decline. And the scary part? Most people don't even know they have it until it starts causing serious damage. There's a reason it's called the silent killer. So, what's a healthy blood pressure reading? Generally, we aim for around 120/80. That top number, the systolic pressure, is the force of blood when your heart beats. The bottom number, the diastolic pressure, is the pressure between beats. Studies like the Framingham and Sprint trials have shown that even modest reductions in blood pressure can dramatically lower your risk of cardiovascular disease and might even help you live longer. Now, let's talk action. What can you do today to lower or control your blood pressure? Here are 7 effective, science-backed changes you can make at home. First up, exercise. Just 150 minutes a week of moderate to vigorous activity, think brisk walking, biking, swimming, can make a significant difference. One patient I worked with started with just 10-minute walks after dinner and within 2 months, lowered her systolic pressure by over 8 millimeters of mercury. Next, let's tackle salt. Most people eat way more sodium than they realize, especially when it comes from processed foods or restaurant meals. Cutting back on salt can reduce blood pressure significantly, especially if you already have hypertension. So skip the salt shaker and read labels when you shop. You might be surprised by where sodium is hiding. Diet plays a huge role, too. The DASH diet, short for Dietary Approaches to Stop Hypertension, is one of the most effective ways to eat for heart health. It's rich in fruits, veggies, whole grains, lean proteins, and low-fat dairy, and it cuts back on saturated fats and sodium. Alcohol? The new guidelines are clear: less is better. Even small changes, like cutting back to 2 standard drinks or fewer per week, can positively impact your blood pressure and overall health. Next on the list is weight. Excess body weight, especially around the waist, puts a strain on your heart. Reducing just 5 to 10% of your body weight can lead to measurable improvements in your blood pressure. Combine healthier eating with more activity, and you'll be well on your way. Number 6, stress management. Chronic stress keeps your body in a constant state of fight or flight. That means elevated heart rate and blood pressure. Mindfulness, meditation, deep breathing exercises, and just setting aside time to unplug can all help. Trust me, one user told us she started doing 5 minutes of breathing exercises before bed and saw real improvements, not just in her numbers, but in her sleep. Speaking of sleep, quality matters. Aim for 7 to 8 hours a night if possible. If you wake up tired or your partner says you snore, talk to your doctor about a sleep study. Sleep apnea is a hidden cause of high blood pressure that often goes undiagnosed. Bonus tip: get a home blood pressure monitor. They're more affordable than you think, and tracking your numbers at home gives a more accurate picture than a single reading at the doctor's office. Look for arm cuffs instead of wrist versions for more reliable results, and log your readings to share with your provider. Oh, and one more thing. Don't underestimate furry friends. Pet ownership, especially dogs, has been linked to lower stress and better heart health. Plus, they keep you moving. Bottom line, there's a lot you can do, starting right now, to get your blood pressure in check and feel better in the process. Worried about your own health? Start by checking in with a UB symptom checker at ubhealth.com. It's medical grade, doctor-approved AI is like having a full on-call healthcare team right in your pocket. Always 100% free. And if you found this video helpful, make sure to like and follow for more doctor-approved info you can trust from UB Health.